This is Bruno Larvol with Larvol and Friends. Every week we talk with a friend of our company. First, my usual infomercial. Larvol is a SaaS company. We sell software and data solutions in healthcare, in particular, to pharmaceutical companies. And medical affairs is a big target for our products. Competitive intelligence, R&D, commercial. We love everything that has to do with data, healthcare, drugs, drugs and bugs, I would say, and increasingly, obviously, AI. And today we're going to touch about a number of these items with Dr. Monika Lamba Saini, who is someone I know for quite a few years. So wonderful to reconnect with you here on the podcast, Monika.
Same here, Bruno. Thank you so much for inviting me to this podcast and a very warm hello to all your listeners. I know, Bruno, we go a very long way back, I guess somewhere around 2006 or 2007.
Yes.
I met you at ASCO in Chicago, and I was presenting on gastrointestinal stromal tumors, our experience in a tertiary cancer referral center in India. And I had traveled from Bangalore, India to Chicago for the presentation. And I still remember meeting you around that point of time. And it was exciting to know that in those early 2000s, you had a company which was completely virtual. So it was something which was very interesting to me. And, I have seen that the company has grown over the last so many years. And it's exciting to be on this platform with you.
Well,
So,
thank you for rewinding the tape, so to
yeah.
speak, and reminding me about the ASCO. I was at ASCO a few days ago, and it was quite extraordinary. The ASCO, of course, the largest cancer conference in the world. I think we had 42,000 participants, although uh, Taylor Swift was in town at the same time, and she has 72,000
Okay. So she
participants.
was bigger than ASCO, right? But
Yes,
yeah,
yes.
but yeah,
It's
I guess ASCO is like an annual pilgrimage for,
for sure.
all people who are engaged in oncology and healthcare around oncology. So yeah, I
Uh,
think it's an annual pilgrimage. And
it
I
is.
guess even for people who do not attend ASCO, like I could not make it this year or the year before that. But, we continuously observe and read whatever is being discussed at ASCO or whatever comes out after, ASCO or its proceedings. So it definitely is a very important conference as far as oncology is concerned.
Yes. The biggest announcements of progress is made in that conference, which is
Yes.
always held in Chicago at the McCormick Center.
Yeah. Yeah.
Um, you mentioned the virtual nature of our company, and you also alluded to the fact that things have evolved, changed, grown. And of course, with the pandemic, we were not special anymore because many companies went completely virtual. But knowing me, uh, I wanted to go to the next level, and so you should be ready to buy and read a book soon that I'm writing with a
Interesting.
ghostwriter about how we are the first company, 150 people, to be completely managed in not just remotely but in virtual reality. So instead of Zoom and Teams call and so on, we put a headset on and we meet with our colleague, including our great executive producer Shahir Sheikh, who organized this podcast today. We put the headset on, and we meet in all kind of extraordinary places. This morning we were on some kind of weird planet, and we were talking about various things together in a
Interesting.
on a red planet somehow. So
Hmm.
this is we're pushing the envelope of what can be done remotely. And in a way, we ask people to come to the office actually, except it's
Hmm.
a virtual office. We say, no, you have to come, please. You have to put the headset on and you have to come in avatar, not completely in person.
Right. Right. No, I understand. And, and also that this concept of virtual reality, I think I would be very interested in attending one of your offices some point of time, just for experience. Yeah.
We will organize that. Shahir and I will invite you, and we'd love to have you. We actually have keynote speakers in many of our events, and it'd be
Mm-hmm.
have you be a keynote speaker. Before we continue and talk about the role of data and AI, in oncology and in your field in particular, pathology. Uh, Give us a quick snippet of your experience, of your professional journey.
Uh, Bruno, you, I think, have a fair idea about my background, but for the listeners, I'm a board certified pathologist with 15, I would say now going to 20 years of experience in the diagnosis of both benign and malignant diseases by cytopathology, histopathology, and also integrating molecular pathology. I worked in academic institutes, research centers as a part of my PhD, and I'm presently the scientific director of pathology at Q Square Solutions, IQVIA, at Edinburgh, UK. My experience spans across different countries, doing my MBBS and MD in India, then my PhD in molecular pathology in Belgium, and now working towards my FRC path here in the UK. So it is basically, you see, three continents, different countries. I speak multiple languages. I'm the author and reviewer of many publications. And I am passionate about digital pathology and development AI driven pathology. So that is in a nutshell about me.
What's interesting about pathology is that people from the beginning of AI, Monica, thought that's an area where AI can play a role in terms of finding pattern and using image recognition, and perhaps even at some point, and you'll tell us whether we already at that point, in some cases being better than the human eye. Where are we on that on that direction? And in terms of at least maybe histopathology, is AI going to compete with you, or even sort of make your skills, just to be provocative, obsolete?
That's a very good question, Bruno. And let me just, start by answering your question by saying that, artificial intelligence we know are now is now being applied to, let's say, a lot of medical subspecialties like ophthalmology or dermatology or radiology, actually, for a long time now, and now pathology. I would say that the much awaited adoption of AI in pathology and the transformation of pathology is happening at a much slower pace than we observed in other fields like radiology. So, because if you look at radiology, the first, reports of AI use date back to, I guess, somewhere in early 90s, when it was used to detect microcalcifications in mammography and was more commonly known as computer-aided detection. And now with, AI, we have the emergence of radiomics, where digital images that are normally interpreted by radiologists in a qualitative way are transformed into quantitative data. With pathology, I think the first thing was to, not replace, but at least have digital imaging or digital imaging along with the microscope as well. So for pathology, the push to adopt digital means was precipitated by the pandemic in a big way. The pandemic also precipitated a change in the regulatory climate around digital pathology. Because in March 2020, the College of American Pathologists won a waiver from Centers of Medicare and Medicaid Services regarding remote pathology work. A month later, the FDA issued guidelines for the remote reporting of pathology slides during the pandemic. And recently, I guess around maybe 3 weeks earlier, somewhere, if I am not wrong with the date, somewhere around 16th May, FDA issued permanent guidelines around viewing slides remotely. So now you see that, we understand that pathology, which is a very image rich specialty, is a very strong candidate to be impacted by advances in AI. And right now, if you ask me, the key applications of AI in anatomic pathology include assessment of prognostic biomarkers,
Hmm.
let's say like Ki-67 in breast cancer, or tumor grading in prostate cancer, or diagnosis of metastatic breast cancer in lymph nodes, or also focusing on automated quality control. Other AI applications, which some of them even have the CE IVD mark here in Europe, are, the ERPR or the Chi67 staining. We also have focus on, I see in emerging software on counting lymphocytes or, looking at TILs or software for QCing the slide. However, despite all the progress we have, few algorithms are currently in routine clinical use. And also, I see that there is a dearth of studies evaluating their impact in clinical settings. So, I don't think that the question, coming back to your question, that whether AI will make a pathologist obsolete, the answer to that question is no, because AI can be a very good, I would say, a diagnostic aid or an adjunct or like an assistant to the pathologist, where it can do monotonous tasks like, let's say, looking at mitosis or counting at mitosis, for making these tasks which are very laborious and monotonous and time consuming for the pathologist, to get this done for the pathologist in an automated and probably a more detailed and precise manner.
Mhm.
But will it replace the pathologist? No. The answer to the question is that the pathologist who will adapt AI will
Mhm.
replace the pathologist who will not adapt AI.
And so, right now, in your current practice, how much are you using AI, if at all?
No, we are definitely, trying to integrate AI into our, since I work in a clinical trial atmosphere, we do have requests from, sponsors wherein we are which they are wanting to integrate AI along with obviously visual scoring of the slides for trials as an exploratory basis. Now, the interesting point would be when these exploratory studies actually become, a, a part of clinical or routine clinical or diagnostic settings. So that translational gap, I think we still have a lot of translational gap. And that is something which I guess in the coming years we will need to address or is being addressed uh, now as well when we speak.
Yeah, I understand. Um, are you following a different part of AI as well? The whole large language model, ChatGPT. Have you played with that part of AI yourself?
Uh, I guess when it all broke around, was it last year, November, somewhere around that time?
September 22. Yes.
September. Yeah. Okay. So I somehow, I think it was, yeah, around autumn. So I have played around with a bit, and we do have, talks of generative AI. But I think at this point of time where we are looking in for AI in medicine, it is not that we have to build an isolated algorithm. We need to build a digital transformation. So that kind of transformation and that kind of, a digital transformation of medicine, for that, we will have to be very, very careful. We will have to be very mindful to address that significant AI translation gap. Now, why is this gap? It could be because of, we have a lot of ethical concerns. We have algorithmic bias concerns. Now, those bias concerns could be due to, let's say, patient gender and race algorithmic bias. There are concerns regarding patient privacy or patient safety outcomes. So, all this have contributed to a significant translational gap in, I would say, pathology, or for that matter, in medicine as well. So, for all this to, for the adoption of these AI into healthcare domains or into daily clinical practice, AI systems need to be approved by regulators. It needs to be integrated with the hospital record systems and standardized to a good degree that similar products work in a similar fashion. We also need to train the clinicians or the diagnosticians for this. And who will pay for this? It needs to be paid by somebody. So paid for by public or private payer organizations and updated over time in the field. So I think these challenges are definitely there. And uh, for medicine to adopt this in routine clinical settings,
Mhm.
these are some things which we need to work on.
If you think about that ChatGPT and similar AI language model, you mentioned
Mhm.
data privacy. So there is a question about data privacy, which is interesting, which is that if I describe a case to ChatGPT and I ask a question in oncology,
Right.
am I breaching patient privacy guidelines? So, in other words, is the fact that the profile or the condition of that patient all of a sudden is going to be used to further train the AI. What does it mean? I mean, arguably, people cannot know about that patient,
Right.
or they cannot probably even retriangulate who that is, although that could be an open question. But we're training an AI based on that patient in some ways.
True.
Now, I think that the power of these models is going to be incredible, and that we're going to be surprised how quickly, even in medicine, where, as you know, things tend to be slower for many good reasons. I think
Right.
we're going to be surprised how quickly AI will become needed and not go away after a while. So this is an area where Larval is working on, and we have a ton of very interesting projects. Not so much about pathology, but other aspects of AI applied to healthcare. Do you rely on social media conversations in your professional interactions, and also even in the sharing of knowledge in your field?
Yes, we do. We do because we realize it is a very important, uh, these social media platforms are very important as far as communication or as far as exchange of information regarding let's say a slide or a diagnosis is concerned. We see more and more, as I'm a pathologist, I can speak of pathologists trying to share, because now with digital aids we can put a slide online, and then if you have a doubt regarding a slide, you can get second opinions right away. So yes, people are using more and more social media platforms, and not only for diagnosing. I think they have become a very good they have become very good teaching models also. There are pathologists like, let's say, Gerard Gardner, or I don't remember other names at the top of my head right now, but yeah, you have YouTube videos, you have Twitter exchanges over diagnosis, over slides, over conditions. There are teaching aids over there. Also, I see that, there are many hospitals or colleges right now which are trying to create like an image repository wherein you can go and look at certain slides online. So there is definitely a lot of social media conversation regarding slides, and also regarding digital imaging and AI applications around it. In fact, if you look at it, every week I see that there is always some of the other publication about an algorithm being published, or somebody has done research, or they have developed a model and tried to compare both human and machine regarding a particular model, or also what are the diagnostic features they have uh, learned from that. So I think that kind of conversation is very, very, I would say, hot right now.
I cannot wait to see what's going to happen. I'm working on a business plan for a spin-off
Hmm.
of Larvol. Actually, I'm going to make it a pre-announcement for the listeners. The name of that new company is Complima,
Hmm.
Complima.ai. And what Complima is doing is that it's applying AI to cancer data in general, and in particular to the type of cancer data that Larval has been collecting and building a model around over the years. And the playful motto for the company is AI will kill us, but before that, it's going to cure cancer. And it's a little pushing it, but because first, I don't think AI is going to really kill us, but it's in a way a legitimate general question. And also, and I the concept of curing cancer is a very complex question because, of course, um, uh, cancer is, in a way, a disease of information. Copying DNA at some point is going to introduce mistakes. Some of these mistakes are going to lead to uncontrolled behavior from cell. So
I like the way you are describing it, you know, for a
uh-huh.
layman also. I really like the way you've described that.
So it's a little bit of a double joke because we cannot truly completely cure cancer. We can do a ton of things, but ultimately, cancer is going to be a long term part of our life as human. And also, I don't necessarily believe AI is out there to kill us, although it could make life and death decision in some ways. Absolutely
Yes,
can. I mean,
yes,
in many
yes.
ways.
For
Um,
sure it can. For sure it can.
it's already
I think
used to recommend certain. My wife had a. Sorry to interrupt you. My wife told me the other day. Oh, the AI sent one of my patient to hospice, uh, and I said, but
mhm,
he's not dying.
mhm.
And the AI decided, oh, that person goes to hospice, right? So maybe it's happening already. I didn't mean to interrupt you. You
No,
were
no, no
saying?
worries, no worries. I was just because uh I congratulate you for the spin-off which you've announced right now. So I know like how you have helped your other, the your company grow. I'm sure you will do wonders with this new venture of yours. But yes, I totally agree with you that data analytics is one of the top AI applications in healthcare today. I think with hospitals and research institutions will be able to use AI to analyze large amounts of data from lab results or electronic health records or other sources to identify patterns or trends that researchers can use to predict future health outcomes. Also, I think, AI with increasing computing capabilities will be able to analyze large amounts of data from, let's say, patient records or clinical trials. And it will help providers identify which patients might be most likely to respond to a specific treatment. So, yes, data, as we say, data is the new oil. So, yeah, I agree with your idea that, yes, data is going to be huge, not only um, in terms of looking at things and analyzing, but also as a predictive tool for, health outcomes or for linked to a specific treatment too.
Uh, One of the sides of pathology that you mentioned is molecular
Right,
pathology. So biomarkers,
right,
mutations, definition of a
right,
tumor not from its tissue of origin, lung
right.
versus breast, etc., but based on its molecular making, a mutation in that gene. Um, uh, any comments on molecular pathology and how it's evolving and maybe where it's going? Because that would be an important part of the fact that cancer is increasingly becoming a data science,
Yes.
and that's a big part of it. So, any comments on uh, molecular pathology?
Yeah, I think, what we are seeing is that Uh, as I feel that as a pathologist, we are now, with the help of AI, able, or at least, there are studies which show that we can support oncologists by directly extracting prognostic and predictive biomarkers from tissue slides. So there are studies already happening with this. Also, I guess, in the future, we will be able, or clinicians may use this information, the molecular information, the clinical history, the genomic profile, the phenotypic characteristics to identify tailored treatments. So, the combination of data, statistics, and these weighted observations in a neural network can be highly predictive. Also, apart from what we are discussing right now in terms of combining mm, clinical history or genomic profile or phenotypic characteristics, what I also feel that apart from this, you will also have AI help transform binary objective endpoints into, let's say, a more quantitative measure of disease severity. So that also, we already saw one of the Google AI applications trying to do that. Apart from what I mentioned to you, I think there will also be, there are models which are being developed at the moment to examine minimal residual disease in terms of cancer, and then combining it with phenotypic data to predict the likelihood of cancer relapse. So this will all help in, developing more targeted therapy and effective treatment decisions.
Yes. Um, Monica, we're getting toward the end of this 30-minute together. And um, as you know, at the end of each of these podcasts, Shahir Sheikh, our producer, is saying, make sure to think about a takeaway for our listeners, something that they will remember from our conversation today, something that perhaps will impact. Maybe you never know how a comment, a statement impact their life. So assume, Monica, that someone just joined now, didn't listen to
Mm-hmm.
anything we said, nothing at all,
Mm-hmm.
or
Mm-hmm.
forgot, or didn't pay attention, was cooking, whatever. uh, there is one sentence, one phrase, one word that you would like to leave for them as we close the podcast today.
Uh, that's something interesting. And uh, I think I would like to say two things here.
Hmm.
For especially the first one, I would say, tailored to uh, pathologists and also clinicians and everybody in the field of healthcare is that AI is here to stay now. We have to be mindful with how we are going to use it in the future. It is like a nuclear energy. You can light up a city, can also blow up a city. So we need to be mindful of the use of AI in the future, but there is no escaping it. We need to adapt it. We need to, formulate the right regulations around it. We need to structure it well so that it gives us the best, so that we can extract the best out of AI as a tool for the pathologist or for the clinician. That's one thing for me. And the other thing, which I think I already mentioned, was that we do not have to just develop a diagnostic algorithm in isolation. We need to completely digitize healthcare in general.
Monica, Dr. Lamba Saini, thank you very, very much for taking the time. And thank you to our listeners. Looking forward to seeing you next week for another edition of LARVOL and Friends.